Professor Evelyn Korkor Ansah explained that while Ghana continued to see reduction in deaths and admissions for malaria, there has not been improvement in the number of reported malaria cases.
Also, that in Ghana as well, the deaths were going down sharply and now is stalling. And then treated nets that would have helped, we are going up but not so good. We are progressing but not as well as what we were doing before. The use among pregnant women and children, same. And then we give pregnant women drugs to prevent malaria. This is called the intermittent preventive treatment for malaria. And that also, you see a slight downward trend at the end of the lines you are seeing for all the doses. So that is a challenge.
She therefore called for concerted efforts from the citizenry towards eradicating the life-threatening disease.
No intervention, no matter how well tailored, will achieve the expected impact without the buy-in, the input and active participation of the community. And in Greater Accra, the malaria control program has realized that people will not sleep in treated nets in their homes. They will do something else. So you better look at another thing for that. And therefore, the tailoring has been done based on knowing Greater Accra and knowing what happens and how people live and how the social construct is. Then leadership and accountability is key. We must make relevant data available in every locality to leaders and the community in a form they can understand and take action on. It must be data that will immediately bring up the response. I say we are the crossroads in our fight against malaria. We cannot continue to do the same things. We will get the same results. It begins with a change in our mindset and a change in our attitude towards the disease. We must rethink and resolve to do things differently if we are to see an acceleration in our progress towards ending malaria.
The Vice-Chancellor of the University of Health and Allied Sciences, Professor John Owusu-Japan, implored stakeholders to harness the country's potentials towards ending malaria in Ghana.
The burden of malaria continues to be very, very high. As we speak now, China's dossier is being reviewed. Professor Binka, also of UHAS, is on the panel. Almost every panel that they constitute to do these things, you find Ghanaians on the panel, and they come to UHAS. I guess the point I'm making is that if we are being asked to go out there to go and assess and certify, it means we know what to do as a country. So what is it that is preventing us from doing what the others are doing, whose script we are marking? I think for me, this is something that we need to ponder on as a nation. We have the potential, we have the capacity, and therefore we need to influence the people who make the decisions.
Fred Kwame Asari, Joy News, Ho.